Your anxiety and low mood may actually be coming from bacteria in the gut. Many women don't realize that there's a connection between our gut and our brain, and this is called the gut brain axis. What this means is that there's certain bacteria in our gut that can control certain neurotransmitters, little molecules that our nervous system needs, as well as other factors that help to control our mood and how we feel. Here are some symptoms that could indicate that your mood disorders or anxiety could be coming from something that's happening in your gut. Number one is that the anxiety kind of just comes out of nowhere and is not triggered by anything. This could be an indication that your symptoms are coming from your gut. Number two is that you're having gut issues, things like bloating, an upset stomach, diarrhea. Something just feels off with your gut, but you're not entirely sure what it is. This in turn could be driving some of the mood problems that you're having as well. Three is that you're having a lot of cravings for things such as sugar, for example. That could also be indicative of some kind of an imbalance in your gut. So, how do we start to understand some of these imbalances and if they are happening inside of your body? The best test to understand what's happening in your gut is something called a GI map test. It's a test that looks at all the good bacteria, bad bacteria. It looks at markers of inflammation in your gut. It looks for infections in your gut. And this is really the first step to understanding what is happening inside your gut that could be driving these symptoms that we discussed previously. So here are a few examples of things that I typically find that could be causing mood disorders in my patients. Number one is something called a candida or yeast overgrowth. Yeast are very common in our body. They're actually found everywhere on our skin and our gut, but sometimes there's an overgrowth and there's too many of them. So they're kind of like these, partners in our body. They're part of our ecosystem. But if there's an overgrowth, that could lead to symptoms. So when doing the GI map test, we're able to quantify, for example, how much yeast you have in your gut. One bacteria in particular called the bifidobacterium is linked to mood. And sometimes if this bacterial balance is off, that can also lead to mood disorders. And that is something we're able to test using the GI map test. Next is high markers of inflammation. For example, if you have high levels of calprotectin or something called zonulin, this can indicate a lot of inflammation in your gut or that you have something called leaky gut, which means that the cells in your gut are not connected to each other like they should be. And there are things from the outside world that could be getting into the inside of your body. With this type of personalized testing, we'll take the guesswork out of whether something is happening inside of your gut or not. We'll be able to get a clear indication of exactly what's happening with the bacteria and these markers of inflammation in your gut. Next, I wanted to talk about 3 bacterial strains specifically that can be used if you have certain imbalances found on the GI map test. The first is a specific strain of lactobacillus that can help to balance the microbiome and the flora in your gut. This particular strain of lactobacillus can balance something called GABA, GABA, which is a neurotransmitter, and can actually increase the production of this molecule. There's another probiotic which has bifidobacterium, which can help to balance your cortisol levels. So that can be used when we find certain imbalances in your gut. And the last is something called Saccharomyces. This is a beneficial yeast that can help to balance inflammation in your gut and bring things back into the balance that your gut needs. In addition to this, you can eat probiotic foods such as leeks, asparagus that have these prebiotics that help to then feed the probiotics that you're on. One example of how I use the GI map test to help my patients was a patient who was having a lot of digestive issues. She was having a lot of bloating, abdominal pain, and at the same time, she was having a lot of anxiety that was just coming out of nowhere. So we were able to find that she actually had an imbalance in her bifidobacterium and put her on the correct prebiotic, probiotic, as well as some other supplements that helped to bring in the balance in her gut, helped to lower the inflammation in her gut, and she was feeling better within a few weeks. Her anxiety had improved and she was able to start doing the things that she likes. She had a lot less abdominal symptoms as well. This example shows how important your gut is if you're having mood issues or anxiety issues or even depression. It's very important to examine what's happening in your gut, address it so that you're treating the root cause for your symptoms. If you're dealing with symptoms of brain fog, mood swings, anxiety, depression, and you don't know where these symptoms are coming from, it would be an amazing idea to get a test to see what's going on in your gut, and we can do that for you. If you'd like to learn more, reach out to us for a free consultation or book your Digest IQ or Hormone IQ tests right online.